So we're starting off right lateral, left lateral compensation. On lateral lumbar, there's a loss of curve, actually a reversal of lumbar curve. Lateral flexion, we're going to work tissue on the concave portion of the left side. And luckily on the bending films, it shows a very nice reduction. Okay, with a reverse curve. So we're starting off in abdominal suspension. Coming up suboccipital area, there's an increased tone on the left. So I'm challenging the anterior to posterior, superior to inferior direction. And that evened out the legs. I need to do a second challenge, more lateral to medial. And that made it not as good. So I'm going to take that in an anterior aspect. And I'm just going to work the tissue on the concave portions. So we see the right lumbar sacral angle until there's a fluctuation. Then until there's a fluctuation there as well. Yeah, beautiful. So the 10 cycles.
Can I make a hole right here?
Huh?
Can I make a hole right here? I can breathe.
Move your hands. There you go.
Okay, thank you.
So now distraction and then lateral flexion. Now the muscles on the concave portion of this should be relaxing. And they actually are. Except for right there. So vibrate on the contralateral side. Traction, they relax. Then on lateral flexion, they're moving correctly. So now that they're moving correctly, we're going to set the draw, distract, laterally flex, and do a very gentle drop. Since there's some rotation there, some meningeal tension release.
Oh my gosh.
So it's very gentle. It looks gentle on film, okay? This side of it. It's close. It goes right here, honey. It goes right here. Go on your side. Face me.
You can take table 2.
Mesa número 2. Anterior C1. Now go way over on the other side. Now you see the spine's in a fairly neutral position. So very, very gentle. Until the intrinsic muscles change in tone. Go right on your back. Now support the occiput on the left. Checking for the sutures. Sagittal suture is off. Since all the adjustments we're doing are to change the brain, actually moving the sutures back in place so the brain gets the right nutrient. And you see very little pressure, head's not turned hardly at all, and a slight lift. And this is way at the top of the thoracic. On the convexity, so here's the left lumbosacral angle, and right upper left. I know. I'm going to work the interosseous membrane to restore dorsiflexion. Did we give you a block of wood yet?
You did. And I have them.
Have you used it?